Access to health care can be a real hassle, especially for the nation's 2.9 million military family members. Mike Gooding tells us Senator Tim Kaine got an earful about this issue today in Hampton.
Well, that is right. Senator Kaine said he was actually surprised that he's heard all about the problems for vets at the VA, but he said that this was the first time he's heard the horror stories told by the families of active duty.
It's just something that a lot of military spouses have grown accustomed to, and we are trying to break that red tape and get our voices heard.
Senator Tim Kaine met for an hour and a half with 19 military spouses at Thomas Nelson Community College. They spoke of the obstacles they've encountered in getting TRICARE to approve coverage for their children, particularly when they must relocate frequently. They talked about getting timely access to mental health care. They said there's always a lot of red tape, and at every new duty station it's like starting over, especially when it comes to constantly having to prove existing and chronic conditions every time they move.
I don't think I would have predicted when I came that I'd have an hour and a half long discussion and 3/4 of it would be about health and health care.
Kaine vowed to try to help with amendments to this year's National Defense Authorization Act.
I have very little doubt that some of what I heard today, we're going to go back and start to figure out, can we do some things in the defense authorizing bill to respond to some of these issues.
Said that the purpose of today was to try to gather input to help him in his new role as co-chairman of the Senate Military Families Caucus. He said that today's session was extremely helpful. Reporting live, Mike Gooding, 13 News Now.